care of ourselves and do the right thing. So according to the DSM-5, you have to have these criterias. You have to meet this criteria. Kisha, your English, you have to meet this criteria for a professional like me, for example, to diagnose you at uko na GAD, yeah? So the first one is criteria A. Say A. Criteria A. Excessive worry. So you have anxiety if A. Excessive worry is occurring for more days than not for at least 6 months about a number of things, not just one specific thing. It's not a specific phobia. It's worry about a lot of things. Generalized anxiety. So for you to qualify, you must have A. Excessive worry occurring for more days than not for at least 6 months about a number of things. Yeah. Criterion B, you have GAD if the individual or if you find it difficult to control the worry. Sasa umesema, hey, leo ni Tuesday, acha nikae chini, let me worry about my future, let me worry about the economy, let me worry about my acne, let me worry about my relationship all at once. No, you can't help it. It just comes. You find yourself worrying and you can't help it. You can't stop it. You can't control it. Come too. So you must have excessive worry about a number of things for more days than not for a period of at least 6 months. And this excessive worry, you can't help it. You can't control it. It just comes. Criterion C, you must have 3 or more of the following symptoms. Concentration, problems with concentration, you are fatigued, you are irritable, you are restless, you have sleep disturbances, you're not able to stay asleep, you're not able to fall asleep easily, or you're not getting enough sleep. So sleep disturbances, and you're having physical symptoms like muscle tension, like uja relax, your body is all tensed up. So if you have any 3 or more of all these symptoms, I will list them below. You probably have anxiety. Yeah, so 3 or more, you just only need 3 or more. So it could be a combination of you are fatigued, you are restless, and you are irritable. It could be that you cannot stay asleep, you have problems with concentration, and your body is all tensed up. Any combination, 3 or more of these symptoms. Then criterion D, the worry and physical symptoms cause clinically significant distress that impairs normal functioning socially, occupationally, or in any other way. So this excessive worry that you cannot control, that has been going on about a number of things for at least 6 months, inakufanya you're not able to function normally, either in your relationships, socially, in your interactions with people, or at work or school. You're not able to function well because you are impaired. You can't stop worrying, na inakufanya usifunction vizuri ama hata usifunction at all. Yeah. And then criterion E, you have generalized anxiety disorder if you meet this criteria that the disturbance is not attributable to the physiological effects of a substance or any other medical condition. So you might meet all these criteria from A to D. Alafu when me as a psychologist, I'm doing an assessment, nikuulize, and have you been taking any drugs? If yes, are they hallucinogenic? Are they causing hallucinations? Like if you come to me, you have anxiety, and 2 weeks ago you were on a marijuana spree, you took a lot of bang, maybe that's the reason you have anxiety, because it is hallucinogenic. It's making you hallucinate, it's making you uneasy, it's making you restless. Then it's not GAD. It is the bangi and the consequences of the bangi. So I can't say you have a disorder. Ni bangi inako affect. But if you have ruled out any drugs, any medication that could cause anxiety, then we say, okay, it is anxiety. It's not any other drug affecting you. It's not any other disease affecting you. It's not any other medical condition. And then finally, we say it's a tick for generalized anxiety disorder if you meet this criterion that the disturbance is not better explained by any other mental disorder. So when you come to me and you have these presenting symptoms, I assess, I ask about onset, duration, frequency, and then you're ticking the box. You have 3 or more symptoms that have been going on for more than 6 months. It is affecting your ability to function. All these things, like enyewe naona, hey, this person has GAD. But nikifika kwa the last criterion ya kuprove for sure you have GAD, you tell me of other symptoms, ama you tell me that you have another mental disorder, like maybe bipolar 2, and that's the reason why maybe you have some of these anxiety symptoms. Therefore, it cannot be GAD. GAD needs to be GAD alone. I cannot diagnose you, you have GAD and you have another mental disorder. I will have another way of diagnosing it. It will be anxiety, yes. It will fall under the anxiety disorder spectrum, yes. But it won't be GAD. GAD has to be GAD alone. It can't be you have generalized anxiety because of another medical condition, because of another mental disorder. So you have to rule out other mental disorders for you to say, this person has GAD. You feel me? I hope I've made sense and it's coming to life how we are able to diagnose people. That's how we diagnose people, yeah? So you have gotten a sneak peek into being a psychologist. So those are the symptoms. Before we go to the management techniques, I'll read some of the habits that worsen anxiety. So do not do these habits. Do the opposite. You feel me? So habits that make anxiety worse and why. So I'll explain kidogo why they make anxiety worse. So skipping meals. Skipping meals is not good because your body is not getting the nutrients it deserves, like glucose, which is very important in your bloodstream. It rids you of problems like hypoglycemia. When you don't take enough food, you have a lack of glucose, which causes hypoglycemia. Hypoglycemia has been linked to irritability and nervousness. Yeah. Then number 2, habits that make anxiety worse: drinking caffeine, a lot of caffeine. If you're dependent on coffee every morning for you to be functional, that's a red flag. Stop it. Drink more water, reduce your caffeine intake. Caffeine is bad. Why? It's an anxiety amplifier because it's a stimulant, so it makes you hypervigilant. The way you go to town and you're making sure you're walking quickly, and you're making sure you're not stepping on the hawkers' tomatoes, and you're making sure how we be, you're hypervigilant. You always feel so overwhelmed. You're like supercharged. You are super aware. That's not healthy for your mind. It's overwhelming to your sensory system, to your senses. Like you're doing so much at once. So that's too stimulating. So when you drink caffeine, too much caffeine, that's what happens. I'm not saying don't drink coffee. I love coffee and it has caffeine. Energy drinks have caffeine. But I'm saying reduce the intake, especially if you have anxiety. Just try and cut it out yote, and then maybe wean yourself back pole pole when you're recovering, because you can't have severe GAD and you're drinking coffee every day. Like, you're not helping yourself. You're making yourself extra aware. It's a stimulant. Therefore, you will be more aware of everything happening. You'll start thinking too much. Like, it's not good for you. Yeah. The third habit that is bad for your anxiety: reaching for sugar. Like too much sugar. I have a sweet tooth, but come on. I have control over it. Like, I don't eat sugary stuff every day all the time, because it increases the risk of anxiety. Eating processed foods reduces your mood. Not getting enough fluids, not drinking enough water, you're not drinking liquids. Unakula tu. Hata ukunywe maji, ukunywe chai, ukunywe juice, you're just taking solids. Like, that's not good for you. You need enough fluids. Your body is 75% water. Come on. Drink your water, people. Yeah, so it causes dehydration, which is not good for your mind. Poor eating habits, like eating junk food, eating foods that are only rich in a certain type of nutrient, like eating too much protein. You're not eating minerals, you're not eating vitamins. Like, that's not healthy. Like, a healthy body leads to a healthy mind. Yeah, because a lot of trauma is stored in our bodies, and everything psychological is biological. The brain is a physical thing that affects our mental well-being. Therefore, our mind and body are very connected. Therefore, you taking care of your body is you taking care of your mind. Therefore, eat well, eat a balanced diet. Make sure that you eat foods that are good for your brain, like fish that has omega-3 and stuff like that. So do not have poor eating habits, my people. Consuming alcohol is not good for anxiety because it messes with your brain chemistry, the hormones and everything. Lack of sleep, because when you sleep, it's like mental maintenance. You get to recharge physically, also your brain gets to relax a bit, you get to solidify memories, you get to lock in things that happened during the day, things that you learned during the day. They are locked in your subconscious when you are sleeping. That's why kutransnight ikwangi poa, kwa sababu utasahau kila kitu, cause you are giving your brain so much information and not giving it time to process. When does it process? When you're sleeping. Therefore, it's like a mental maintenance. Yeah. And then watching the news too often, like feeding yourself with like negative things happening, that's not healthy for you. Like watch the news, but not too much, not too often. Set you watch news, you're 7, you're 12, you're 4, you're 7, you're 9, you're midnight. Like, okay, it's the same news, you're just watching the same bad news over and over again. Like, what could change in 3 hours? Relax, focus on your life, the things that are good, and watch the news when you need to. Yeah, ignoring your anxiety is also bad. Like, recognize, I have this problem, I need to do something about it. I need to take a walk, shower, drink water, vent to a friend, make an appointment with a psychologist, with a therapist who will help me out, journal, so that everything, hizo vitu zote, hizo overwhelming thoughts that they're in your mind, you get to have a brain dump. Write all of them, burn the paper, like have an outlet, like do something about your anxiety. When you ignore it, it gets worse. It's like someone who has diabetes. They know they have diabetes. They're not living a healthy lifestyle. They're not taking insulin shots. They're not doing something to improve their health, to make the diabetes more manageable. Like the same way, you need to manage your anxiety. Do something about it, and it will not get worse. It will improve, and eventually it will just go away. Yeah, because it's not a lifelong thing. It's not like HIV. It's not like cancer. It's treatable na itaisha. There's an end. Yeah, there's a light at the end of the tunnel. And then comparing yourself to others, because now you'll start being anxious about your life. Go like, my friend is driving a car and me, I'm walking. In fact, I am taking matatus, I'm taking do this, I'm riding bikes. My friend is driving, is going on jets. You, like, that's their life. This is your life, and everything will work out in the time it's supposed to. So, like, just relax, take a breather. I know it's hard, but comparison literally kills dreams, because you will want to do things like other people, and your uniqueness is your superpower. Like, love yours. Like J. Cole said, love yours. Like, just listen to J. Cole. Yeah, you feel me? Like, comparing yourself will do no, like, it will do more harm than good. You can compare yourself and say like, this friend of mine is investing at a young age. That's a good idea. I could also do it. That's healthy comparison, compared to like, my friend is making like 6 figures and me, I'm not. What's wrong with me? Then you'll start having anxiety over the things happening in your life. That's not healthy. And then finally, not exercise. Exercising. Not exercising, because our bodies were designed to move. Like, take walks, move around, don't sit around for too long. Exercise, like, endorphins will be produced, which are natural painkillers, which are feel-good hormones. If you have feel-good hormones, what time do you have to be anxious? What time? You have no time to be anxious when you're feeling good after a workout, yeah? So those are the things you should not do, and the things you should do to combat those bad things. Yeah, finally, management of anxiety very fast. Single tasking. Don't do a lot, because one task is meant to suffer when your attention is split between many different things. Focus on one thing, do your best at it, move on to the next. Yeah, even with like worrisome thoughts, you have all these thoughts, oh my god, I'm not going to make it, oh my god, my acne. Like, okay, acne is manageable, it's small, let me start with it. Okay, why am I worried about acne? I am worried about what people will think, I'm not attractive, whatnot. But then you affirm yourself, you know that you are attractive. Okay, what can I do to make my acne better? I can have a skincare routine, I can go see a dermatologist, I can drink more water, I can change my pillowcase more often. Then when you deal with that, it stops being a worry. You move on to the next worrisome thought. Like, deal with that until most of your worries are over and you'll be good to go. Yeah. Then sleep hygiene, I talked about this. Sleep hygiene is having a conducive sleep environment to facilitate quality and quantity sleep. Managing screen time before bed, I also need help with this, trust me. This is for you as much as it is for me. Like limiting screen time before bed, like read a book before bed instead of being on TikTok, instead of being on your phone, because you will stimulate your mind and you're supposed to be resting and winding down and getting ready for bed. Because when you're stimulated and then immediately after getting off TikTok you go to bed, one, it will affect your quality of sleep. Two, you won't be able to fall asleep very quickly. And yeah, it's not just good for you. And maintaining a clean, tidy sleeping area and stuff like that, that's sleep hygiene. Having a nighttime routine so that your mind iko like, aya tunaanza kubrush meno, aya tumechange pajamas, aya tunasoma kitabu, inajua the next step is going to bed. Like having routines are good for you. It's good for you, it's good for your mind. Yeah, so that's sleep hygiene. And then exercise, it's good because it allows you to stay in the present moment and reduce muscle tension. Remember, muscle tension was a symptom of anxiety. You're able to relax your muscles so that your anxiety is not stored in your body, because sometimes trauma and mental illnesses are stored in our body. That's why when you're depressed, you're tired. That's why when you're anxious, you're restless. That's why when you have PTSD, you see a trigger and you feel butterflies in your stomach. Our bodies are signals, they tell us how we feel. You should listen to your bodies more often. And yeah, so therefore exercising, you will produce endorphins, you will feel good, and it will allow you to stay in the moment. Remember how we talked about forgetting about stuff because you're not in the present moment. Hauwezi kuwa unafanya sit-ups na unafikiria wa mortgage. Utakuwa like, yo, this is painful, yo, I need to do 3 reps, yo, I need to have the right form so that I'm able to not hurt my back, so that I'm able to get the most benefit out of this exercise. Like, you can't work out and you're not, and you think about something else. You'll be in the present moment. Yeah. So you can also do nature walks, you can also do journaling, so that you're able to have a brain dump, you're able to think about your problems in a more constructive manner. Or like, why, like you have journal prompts like, why am I anxious? Why am I worried? What do I not like about my life? How can I change it? What is stressing me right now? Like that will help you to sit on paper, and it will help you to like problem solve so that you can have less worry. Yeah. And then finally, psychologically, you can go for psychotherapy, you can get medication, or you can have a combination of both talk therapy and medication. Though the best option long term, according to research, is psychotherapy, where you can be able to have treatment plans like CBT, which is cognitive behavioral therapy. Cognitive, dealing with the mind; behavior, dealing with actions. So what you are thinking, what you are telling yourself, what you are believing, and what you are doing. So when you change this, it will change how you behave. When you change what you're thinking, what you are telling yourself, the cognitive distortions in your mind, and changing your behavior, you'll be able to get rid of the anxiety. Maybe you have a fear of mathematics lessons because the teacher told you you're a failure and because you fail at maths. CBT will help you reframe that thought pattern. Like, I'm actually brilliant, I can be good at maths if I work hard. What is the action? Asking questions and you don't understand, doing homework, extra homework, and giving to the teacher to mark and explain for you. the sums that you got wrong. So yeah, that's CBT for you. So yeah, we've come to the end of our video. I know it's been a very long video, but I hope you've taken something home with you. You've learned something, big symptoms to watch out for, red flags, some of the ways you can be able to improve your life so that you do not predispose yourself to anxiety, the diagnostic criteria that we use as professionals to diagnose generalized anxiety disorder, the symptoms that are not very common, and habits that make anxiety worse. So thank you very much for staying. Hey, till this far, I've talked so much. But I pray it's been beneficial. I know it has been actually. Praying that this will save a life. Praying that this will improve someone's life as much as it will improve mine, even as I work towards preaching. I mean, doing what I preach and walking the talk and preaching water and not drinking wine. So, yeah, thank you very much. Share this with friends and loved ones who need to see this. And yeah, I appreciate the love and support very much. Stay tuned for my other videos. I love you all, Sana. So, bye. Take care.